After that introduction, what can I say but thank you. Thank you very much, Dr. Freeman, Columbia University School of Business, for a wonderful 2 days and hopefully a long and productive future together. We've already got the plans underway. Only one thing could make my evening more perfect, and that's if my wife, Eve, were here with me. I miss her. She would delight in this too, as through the years we've worked together to build a family and to build a future. And I think that's what this is about, is building futures. To be honest, I found this great quote. It's from a fellow named Vernon Wentworth. He was a former head of the American Hospital Association, an academic from the University of Minnesota. He talked about what he called retrospective construction of history. The idea is that successes were really the planned consequences of wise prior actions. For me, I don't think anything could be further from the truth. To quote Kurt Vonnegut Jr., a famous author, I was the victim of a series of fortunate accidents, so far as I can tell. Very great fortune in 1987 to meet Dr. W. Edwards Deming. We had been studying variation in clinical practice, clinical care delivery, at a detailed level. Dr. Deming supplied a theory that described it perfectly. He helped me publish that first major paper. He actually helped me write it and refused to apply his name to it. He said it's time for a new generation to kind of carry the baton. I think it was also because it was in healthcare. As I learned more about the man, worked with him for years, but not really at a friend level, more a colleague level, I realized that he was carefully mentoring me. Who can claim to be mentored by the original grandfather of this body of theory and approach? If we have seen far, it is because we stood on the shoulders of true giants. So it feels particularly appropriate. The only way it really feels appropriate is to do this in honor of Dr. Deming and his massive contribution to us all on such a broad scale. A second very great fortune, I came to Intermountain Healthcare. There I discovered an institution that truly lived its mission. The short version, the best medical result at the lowest necessary cost. And time after time, I watched the senior leadership of our institution make real sacrifices to make that true. In a very real sense, I can say that we count our successes in lives. As we've applied these ideas within healthcare, literally thousands of lives a year in Utah, people who would have died who did not. And hard data to demonstrate that truth. I honestly don't believe this could have happened anywhere else. So, Charles, I really only feel confident accepting this sort of an award if it really represents the teams that make up Intermountain. The physicians and nurses, the leaders, my own staff in the Institute for Healthcare Delivery Research, Lucy Sabbats and Ann Ward, who came to make this a special evening. That's a real success, in all frank truth. Finally, though, it has to do with the future. Our country faces massive financial challenges. When you examine them closely, about 2/3 of the problem comes back to health care. We're creating a future that could destroy the country, frankly. You know, it's an interesting thing. You may recall from your college psychology, it's kind of trite because it's so widely used, Maslow's hierarchy of human needs: survival, security, social acceptance, self-esteem, and then finally self-actualization. A very wise man, Dallin Oaks, a former Utah Supreme Court justice and head of the BYU School of Law, added one more element to the top of that. It was the idea of service as the ultimate in human accomplishment. You've all heard the old saying, we make a living by what we get, but we make a life by what we give. As I look at the hand of Dr. Deming reaching down through the years, I can see that in full force. If I had him here today, though, based on the experience we've had since the last time I saw him, here's what I'd tell him. I'd say, Dr. Deming, it should have started in medicine. It really should have. It so matches our underlying core ethical commitments to our patients, our whole value set as a profession. It should have started in medicine. And now it's starting to really define those professions, the healing professions, for a future. I've learned another thing, too, I think that's very important. I've learned that the physicians and nurses who work in Intermountain, the people who've come to my courses down through the years, you see, they didn't understand the real advantage of having students is you get to steal their good ideas. And you do it fairly routinely. It's always a two-way street, back and forth. What I've learned is the real key is to make it easy to do it right. I've learned that they're as dedicated to patients as I am, they're as hardworking as I am, they're as smart as I am. The difference is they don't control the systems within which they work. Those in leadership do. And the key was creating that infrastructure to make it easy for them to achieve the goals that they always held in their heart. Always have held, always will hold. In that regard, we've had a more recent development. Probably the single most important thing I think that we could do to make that true, to make it easy to do it right. Medicine is inherently an information science. And we're now right in the middle of a major project to create a whole new world for medicine through health IT. It's particularly pleasing to see the leadership team from GE, our partners in that enterprise here today. Watch this space, folks. I honestly think you ain't seen nothing yet. We have not yet begun to understand how good we can be for our patients, for people who come to us in their greatest hour of need in many cases. At the same time, I think we're going to solve the cost problem for healthcare. It's going to be based soundly on the foundation that Dr. Deming laid. So really what I'm saying is a series of accidents, and thanks for each one down through the years. Dr. Deming, Intermountain, and my students and staff, thank you.